Welcome back to another episode of Pretend I Don't Know Anything. Another episode of Dr. Brooke Heals. So, we finished out the last episode. We were talking about avenues to start taking. Mm-hmm. And one thing I do want to mention in all of this too is, I would also not be shy to drug test. Like if you think there might be a problem mm-hmm. and they're not communicating and you're seeing signs, they've got incense burning in the room is generally a pretty good sign that something's off. Don't hesitate to, they may not like it, but that's okay if they don't like it. You would rather know if there's something more severe going on, mm-hmm. like opiate use or fentanyl use that you're unaware of, than not know that.
And right? What drug tests would they need for that? Because there are
a lot.
The panels.
Yes. Actually, what I find for drug tests you can get for private use, mm-hmm. actually Amazon, the 12-panel tests on Amazon are good. Yeah. They don't test for everything. They may not have the fentanyl in there. They don't have ETG, which is alcohol test. They don't have kratom. You can't get those over the counter because they're not FDA approved. You have to be a company in order to get that. But there are also drug testing companies around where mm-hmm. they can come and perform the drug test if you feel like something's off. Mm-hmm. You can always reach out to us at Lighthouse, and we're happy to give you those contacts. So that you guys can find those people, especially if you're not comfortable, drug testing your kid. It's not the most comfortable situation. Yeah. So you can bring in a professional to do it. Anyway, just want to go ahead and throw that out there. Yeah. Yeah. Okay. So here we are. We planted a seed. Yep. Right. We've been researching for a counselor to meet with our loved one. Feel like we may have a good counselor. Mm-hmm. Kid may be willing or not. Mm-hmm. How do we want to move forward in this process?
Yeah, I mean, and for fun, let's throw in a good psychiatrist too, okay. Right? It's okay to be assessed, and I think you can assess that from your own place with your family, and I prefer, and people may disagree with this, but I'm going off of my years of experience on this. Counselor first, psychiatrist second.
I agree.
Because I think there can tend to be the message that is heard, whether it's communicated this way or not, is the pill will make this better. And at the end of the day, even though medication can help, it doesn't heal necessarily. And so we want to make sure whatever the underlying things that are happening and that there's partnership. And then just from a quantitative data standpoint, the most success is therapy mm-hmm. plus medication. Make sure that, but I think let's start with therapy first because the rapport there is going to be really important for even just making good decisions. So we got them to therapy in this scenario?
Yeah, so this scenario, we'll go this route. Then we'll go
they didn't go to therapy?
Didn't work out the way you wanted it to.
Yeah, right? I mean, they're going to therapy and things are continuing to get worse. Mm-hmm. It's time to look at what's next. And mm-hmm. I think, even if you want to respect your loved one's privacy, I think hopefully one of the questions you can even ask when you find a therapist is, what level of communication can we have? Not because I want to be crossing any boundaries, not because of anything like that, but do I have a place where if the person I love is continuing to get worse because the therapist sees them an hour a week, mm-hmm. if they're continuing to get worse, what is the best way for me to communicate that to you? Because they've agreed to do this, but things have not been great and mm-hmm. we're pretty concerned. And let the therapist tell you, if you feel like things are not going well, we'll have a release sign. You mm-hmm. can at least shoot me an email or whatever, mm-hmm. That we can communicate the best way for next steps. And I would also ask the therapist, how do you assess if they're continuing to do well? Mm-hmm. And if they're not, what do you typically recommend as next steps? And I think asking them, especially kind of assuming we're diving between what's really substance use issue versus mental health or the both and, mm-hmm. Wherever that's at. And I think just being honest with those questions on the front end. And if you talk to a therapist who is I'll never tell you anything, it's mm-hmm. probably not the collaboration you're looking for. No. Now, please communicate it not as a codependent family mm-hmm. member. You're saying I'm not wanting to cross lines. I'm not wanting to cross boundaries, but there's a chance this could need more. And how can we communicate that well and clearly? And I would think any great therapist would appreciate that very much and be honest with the client too.
Yeah.
Like, look, let's try this. But if things continue to not do well, like, we love you too much to let it continue to not go well.
Yeah.
And leave space for ups and downs and all of that. And, we have families call us all the time. Like, we think it's okay. Do you feel like it's okay? And, yes or no or whatever, it's just being honest about those conversations or like, hey, things seem to be going really well and now they're not. Is this just a normal ebb and flow or is this something we need to be worried about? Like, just leave space for whatever the truth is. And sometimes people struggle and it's okay.
Yeah. Sometimes it gets worse before it gets better.
Yep.
Sometimes healing can be an ugly process.
Yeah.
Actually, kind of all of the time.
Yeah, it's never really all that pretty.
Yeah,
that's true.
And then it starts to turn. I would recommend definitely leaning on the professional that you've researched and you've hired to help here, to let you know kind of where it is in it, because it is common and. As a parent, we so desperately want our kids to just be okay and be happy and make that the case. Got to recognize you're not happy all the time. I'm not happy all the time. They're not going to be happy all the time. Right. And it's okay.
It's fine.
I don't have to own that. I don't have to make it that way for them.
Yep.
I don't have to manufacture happiness for them.
Yep.
Actually, hurting, going through some pain is part of the process, and it's good for everybody to have to do those things.
Yes.
We can remember that we never change without some discomfort or pain.
Yeah.
And I think that's true for everybody.
Yep.
Right.
No
matter what's going on.
Yeah.
Like, why would I change if it's not uncomfortable?
Yes.
Yeah.
That is what builds resilience and grit and wisdom.
Yes.
And it builds your frontal lobe. That's how your brain, is able to make good decisions. Like, so uncomfortable is good. Uncomfortable but safe is great.
Uncomfortable and dangerous, not.
Right.
I also feel that I totally agree with the psychiatrist thing. I think there's two maybe larger issues going on in our country around seeking help in general. One is to want to go for the quick fix always of like, well, if I just take this pill, it'll make it better.
Right.
And it may make it better, but again, that's not necessarily solution in every area.
Yeah. I want to interject 130, like, don't lose your spot, because what I usually hear, and I think you would say the same thing, is this pill didn't make me happy. Not, if we were looking for just better, I don't know that the issue that you're about to get into would actually be. But I'm right. If you thought the Lexapro was going to make you happy, then we need to manage some expectations.
And if it does, where's Lexapro?
Yeah.
So
take it every day.
Yeah. So I like that. Not just better, but happy. I also hear a lot. Well, that's another thing when it comes to medication. I don't feel anything. You're not really supposed to. So like if it's working, you don't feel a direct effect from that. And if you are feeling a direct effect from that, that might be a side effect. Yeah. It's not necessarily a good thing. We tend to think that if we take medications, we should feel something, right? Some way.
And we being
addicts and alcoholics.
That's not the general you. But I do love it's like, this did not alter my mood. I was like, it is not meth. That's right. It did not.
Yeah. I just don't understand.
Yeah.
Why would I even take it?
Yeah.
No. So, yes. But then because of that, and it's kind of a society issue in general. Like, we want everything newer, faster, shinier now, right? And mental health and recovery doesn't work that way. That's not how this works. Yeah. So we tend to want to start at the doctor and back into everything else, right? And I would recommend to go the other way with it. I think the other thing that I am seeing more and more of is that family panics, you know, okay, we do identify that there's a substance use problem here,
Right.
and they're not going to therapist first, and they're not checking out other avenues that are maybe lower impact in life, and they're just jumping directly into we're going to inpatient treatment, right? With the idea, again, that if we go do this, it'll fix the problem, make my son happy,
Right.
or make my child happy, which, once again, that's not how it's going to work. And maybe that's a little bit of taking a cannon to a knife fight, depending on what's going on.
Right.
Like, even if I determine that my kid is smoking pot every day or doing dabs, or maybe even is maybe over drinking on the weekends, that doesn't necessarily indicate a full-blown substance use problem yet.
Right.
This may be something that can be addressed in therapy or in an outpatient setting.
Yes.
And not have to go to all of these other phases. So the two things that we're seeing more and more of, right? And there are long-term issues that come from that. I'm going to start with the medication one. So if we jump right to medication, and medication isn't necessarily what's actually needed in this situation, and then we've gotten with a doctor that maybe has misdiagnosed or misprescribed because psychiatry is challenging and it's based on the individual self-reporting.
Right.
And we already talked about dishonesty being a problem.
Right.
Right. So they're not, and I'm giving it out there. That's not always the case, but
sometimes the psychiatrist doesn't know what they're doing.
True.
Also a thing.
Yes.
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 So we have to find a good one of those too.
Or you get in with a psychiatrist where your son that does have a substance use issue or daughter that has, and they say, oh, my anxiety is just so bad, because they know they can get a script of Klonopin or Xanax from it, which is highly addictive and abusable.
Right.
Right. Because we know what to say to do those things.
Yep.
And now you're really in a pickle, right? Or they put them on a psychiatric medication, an SSRI or something, and it's not the right medication for them, and it's causing adverse side effects, and they actually do need a psychiatric medication, and now they're non-med compliant because they've had bad experiences with this medication that they need. And because we jumped the gun in it and we didn't get enough research done by professionals prior to it, we've set ourselves up for future failure.
Yep.
And a lot more pain and discomfort down the road.
Yeah.
Right. And the same thing can happen with residential treatment. So we get somebody in and then they're getting prescribed a medication maybe they don't need. Right. That happens often. Or they're getting prescribed a medication. They're having side effects from these medications. Or what we did is just take our child that is experimenting with maybe some different drugs and doesn't have a full-blown substance use problem now.
Right.
And we just put them in drug school.
Right.
Right.
Yeah.
And that is, once again, setting ourselves up for long-term problems.
Right.
You know?
Yeah.
So what do we do and how do we navigate all this? Right.
Yeah.
And this, I know it's a lot of information and it is scary. It's terrifying.
Yeah.
To have to face this and go through it. It was terrifying for me as I was going through it.
Right.
Right. I really want to spend like our next time together, you and I, and really breaking down all of the different levels of treatment.
Yes.
You know, so people can understand what each service should be doing.
Yeah.
What would designate good treatment in that.
Yeah.
You know, I know I probably just spooked everybody, right? A little bit.
What I hope that they hear the thesis is take your time. Let's assess. Let's take the time to find good therapists, good psychiatrists, be aware. You know, I mean, that's, I think, the heart. And it is a ton of information. And we find ourselves explaining it over and over and over again, which is why you wanted to do this, and that so that the information is out there, and if it raises questions, great.
Yes.
Then send them to us. You know,
great.
I mean, like, well,
Great.
I mean, I think that, you know, I think that it's okay to like I said, it's like we don't have to be afraid, but like understand there's a lot of nuance and it takes energy, but we want to point your energy in the right direction.
Yeah.
Because if you're going to be exhausted, you might as well do it doing the right thing.
Yeah, and it is okay to be afraid.
Yeah.
But let's not let that fear drive our decision making where we're making poor impulsive decisions.
Yes.
That can have long-term ramifications.
Yeah.
And know you're not alone.
Yeah.
In doing this.
Yes.
There are people that care and are here to support you. Mm-hmm. Contact them.
Yep.
You know. Anyway, thanks for your time, everybody.